White evangelicals are among the least likely groups willing to receive the COVID-19 vaccine. That's according to a February poll by the Pew Research Center. About 45% of white evangelicals respondents say they will probably or definitely not get a shot. Only about 1/3 of black Protestants are hesitant by comparison, and just over 1 in 5 Catholics. As our Kathryn Watson reports, the key to ending the pandemic likely runs through the evangelical church. Encouraging evangelicals who are persuadable is likely the only way the country will reach the estimated 70 to 90% of nationwide vaccinations necessary to reach herd immunity. Kathryn Watson joins me now. She's a CBS News White House reporter. Katie, thank you so much for taking the time to chat with us about this issue. So break it down for me. Why are members of the evangelical community so disproportionately unwilling to take the COVID-19 vaccine?
Sure. Well, you just showed the polling there. That's been something that's been consistent the last couple of months. Kaiser Family Foundation has also done polling and found white evangelicals to be the group who's most likely to say they won't get the vaccine. So that's something I wanted to dive into. It's a community that I have a lot of familiarity with myself. The issue isn't singular. The opposition isn't singular for any one reason. It's very multifaceted. There are evangelicals, particularly white evangelicals, who have concerns for political reasons, for religious reasons, for cultural reasons. So some of the reasons that I dove into a little bit include there are those who are concerned that there are very distant links to aborted fetal cells. There are those who have concerns saying, hey, we just don't have really long-term trials on these COVID-19 vaccines yet. There are those who have some concerns that are very specifically religious, such as those who are concerned that there is some relation to something that's called the mark of the beast in the book of Revelations, kind of a symbol of future times. So there are a number of different concerns on the issue, and that's what I tried to dig into, trying to show that it isn't necessarily one concern, but all of these concerns together, in addition to skepticism of the medical community from the evangelical community that play into this.
Yeah, per your reporting, also, a lot of people just think this is overhyped by people like us, reporters and journalists on TV, talking about how severe this crisis is. Just a really fascinating article you wrote. So you spoke with an evangelical leader and Samaritan's Purse president, Franklin Graham, who said he is pushing members of the community to get vaccinated. What is the message he's putting forth to try and end the hesitancy?
Sure. Well, I spoke with Franklin Graham, who is really well known in the evangelical community. He's the son of Billy Graham, the late evangelist. So he had posted something on Facebook a little while back, maybe a couple of weeks ago, saying, hey, I think it's a good idea for Christians to get the vaccine. I think Jesus would want people to get the vaccine because it's something that we can do to, help prevent illness. He mentioned the story of the Good Samaritan. The Good Samaritan is a biblical parable that Jesus told of a man who saw someone along the side of the street hurting and came to his aid and, provided things that were at the time, the medicines of the time, oil and water and wine and different things to kind of help this man with his ailments. And so he pointed to that in his Facebook post as an example of how Jesus would be not just willing to, but happy to, eager for medical solutions to problems like COVID-19. So he received a lot of backlash on that. All of the comments, almost all of the comments at least, were negative or critical of what he had to say, and just listed some of the examples that I had mentioned earlier about these different reasons for not wanting the vaccine. So I spoke with him, and he basically kind of expanded on what he'd said in his Facebook post. Samaritan's Purse, his international relief charity, has done a lot of work on COVID-19, tried to help a lot of COVID-19 patients, not just in the U.S., but across the world, in Italy, in the Bahamas, in different places, particularly at the beginning of the pandemic where things were really bad. So he said, hey, I have seen the effects of COVID-19 firsthand, and it's not something I want to get. It's not something I want anyone else to get. If there's anything that we can do to, prevent illness, we should do it.
I mean, people may think that, oh, this is just one group, why is this going to have an impact? But in the intro that I read, this actually could have a really significant impact if there isn't a way to bring some of these people to persuade them into getting the vaccine. So what are those efforts?
Yeah.
What are evangelical groups doing to help alleviate vaccine concerns and provide access to the community?
Right. Well, exactly. You mentioned, hey, this is only one community, but it really is a community that represents a broad swath of the United States population. And if we're talking about up to maybe 40% of white evangelicals or more than that who say that they don't want to get the vaccine, that's a significant chunk of the population. So I spoke with one former pastor who was kind of involved now currently with a lot of public health entities. And he started a project, and his name is Curtis Chang, to kind of try to persuade and educate evangelical Christians in general about the vaccine. He's posting lots of short video clips with medical experts, interviews that he's doing to address some of the concerns that evangelical Christians might have that maybe aren't really being addressed by public health officials. So that's one effort that he is trying to do. And he put it very simply to me when I interviewed him. He said, hey, the path to ending the pandemic is through the evangelical church, and it's something that public health experts really need to wake up to. I think that there has been a focus, thankfully, on addressing the concerns, the vaccine hesitancy among minority religious groups, and that's super important. But I think in all of that, there hasn't been as much attention paid to evangelicals who are largely white. So that's something that Curtis Chang is one example is trying to do.
Yeah, that's a really interesting point. Obviously, the White House has to lead the way on this too, in lockstep with these religious leaders, right? So how is the Biden administration trying to get involved with outreach to faith communities?
Yeah, it's something they have certainly started paying attention to more and more lately. I know that they've done some events with Dr. Francis Collins, who is the head of the National Institutes of Health, who is actually a Christian, so is someone that I think would be a little bit more trusted by leaders in the faith community. And yeah, the Biden administration really is trying to work with faith leaders, with pastors, with different people who might be more trusted among these communities of faith than the White House is, because let's be honest, it's a Democratic administration. Most evangelicals, most white evangelicals are Republican, and so that's another issue that comes into play here in the trust factor. So the Biden administration is really working hard to try to connect with faith leaders, to do different events with them, to try to get the message out here about, hey, these vaccines are safe, these vaccines are effective, and these vaccines are really what we should be doing to get back to normal.
Some really interesting and important reporting. Kathryn Watson, thank you.
Thank you.